All right, welcome everybody to episode 5 of Controlled Chaos. I'm your host, Jason Liederfine, U.S. Army combat veteran and current Chief Operating Officer of Cage Fury Fighting Championships, live on UFC Fight Pass. Now, we've got something special today. We've actually got our first in-studio guest, a local martial arts legend and mainstay in the sport of mixed martial arts and Brazilian Jiu-Jitsu, and I'm really honored to have him in studio today, Eric McMahon.
What's up, man? Appreciate having me. We actually live like a mile away from each other.
Absolutely, just right down the street, and there are two cameras, but he is in studio today. He lives in the same town as I do, so it's nice getting to catch up. Now, we've had the opportunity to work together for a long time, and I think we've both seen each other grow in the business of mixed martial arts. Now let's talk about you.
hmm
When did you start training mixed martial arts?
I probably started training '06, '07 around that year. I grew up in Mesa, Arizona, went to school, Arizona State University. Always piqued my interest. I actually watched UFC 1 live way back in the day. I remember, so I've always been, I digress, I've always been a fan of martial arts and specifically MMA. I moved out to Memphis from Arizona. I didn't have any friends. I didn't know what to do. And so I said, hey, man, I'm going to join a gym. I went and joined Memphis Judo and Jiu Jitsu. Started training in Muay Thai kickboxing first, then graduated to Jiu Jitsu. And then at that point, a lot of life changes happened. I got sick and I ended up having cancer. Came back from having cancer and, I said, a lot of people were saying I was mentally tough for being able to go through it, which is like ironic because I didn't have a choice, right? I didn't make that choice. So I said, hey, I want to find out to myself if I am mentally tough. And so I said, I wonder what I could do. I could join the military. And I was a little past that at that stage of my life. I could go run a marathon. I have no ambition to do that. I'm like, well, why don't I strap on those small MMA gloves and do an MMA fight? Let's start training for that. And then if I can get to that fight, make that walk, get in the cage, then I'll prove it to myself that I'm mentally tough. And I did it a couple times. I scratched that itch, and then I became about the business of MMA.
So in 2015, you had a fight with V3 Fights. Was that your first fight?
Um, yes, but I mean the time frame sounds right. I fought twice for V3 as an amateur, and um, it's trust me, I didn't fight anybody tough. And that's the ironic thing. The business, like MMA now, debut amateurs then, even 2015, and now it is worlds different. If I went against a debut amateur now, they would have crushed me.
It's funny, like in the Philly area where we do a lot of events. We have guys that are legitimate black belts, Division I college wrestlers, Muay Thai world champions that are wanting to start their MMA debuts.
Right.
Where back in 2015, you got a stripe on your white belt. You were like, hey, I'm ready for MMA. I can start. And that's when guys were getting in there and banging. And now it's actually made matchmaking a lot more difficult because I've got another debut. And I'm like, yeah, FYI, this guy's a jiu-jitsu black belt, multiple-time IBJJF world champion. And he's making his debut. Oh, and by the way, he's got his own gym on top of that. Like, that's literally the guys that we're matching for amateur debut bouts now, and it really has changed.
I mean, we haven't really got into this, but I'm a referee, right? And when I'm reffing fights of an 18-year-old kid who's built like a man with the skill set where even 10 years ago, let's call it 10, 15 years ago, he could have been a UFC world champion as a 1-0 amateur. I mean, that the skill set that these guys are competing with now, it's non-comparable. It's amazing.
Yeah, the talent pool has definitely gotten a lot deeper because, by the time you saw, UFC 1, you're a high schooler, you're a teenager, you're 15 years, 16 years old, and now kids are starting to train at 5 or 6 years old in jiu-jitsu and in mixed martial arts and in wrestling and all this stuff because that's the goal is they want to get to that level. It didn't start till we were almost past our prime, so it made it difficult to catch up.
Well, and people are training in mixed martial arts now, right? Like in my gym here in Collierville, we have a phenomenal kids jiu-jitsu program, but on Saturdays we train striking and wrestling, right? So I'm wanting to bring that skill set all the way around, and not from a standpoint of I ever want these kids to get in the cage and fight. If they did, great. But also it's like I want everybody to have that well-rounded skill set. But great athletes used to go into the football, basketball, baseball, whatever it may be. And now you're getting great athletes going into MMA and training MMA from a young age. And I don't even want to know what this sport's going to be like in 10 years from now.
Well, I mean, we've just seen such a huge growth, and the talent pool is getting deeper, and we're seeing other countries get involved. 15 years ago, if you told me there was going to be an English UFC champion, an Australian UFC champion, an African UFC champion, I'd have told you you're crazy.
Right.
It was America, Brazil, Japan, and that was pretty much it. Now you've got Russians, you've had Nigerians, Australians. It's crazy how much the sport has progressed. But let's go back a little bit, and let's talk about you and your journey to where you are and how you've gotten there today. So you got sick. You're actually diagnosed with cancer. Tell us what happened, how you got diagnosed, and what really happened to you.
Yeah, so I was 26. I believe I was 26 at the time. I had moved out to Memphis, Tennessee for work. I worked for the NBA team here full time for the for the Memphis Grizzlies. After my first full season with the Grizzlies, working for them in that off season, I was feeling run down all the time, and I'd taken some international trips, and I was like, yeah, I don't know, something's wrong with me. Might be jet lag. I had like 2 or 3 international trips over the course of like a month and a half, so I thought that I was maybe just like habitually jet lagged for a while. That started just dragging on, and then I realized something was probably wrong with me. I ended up going to the doctor, and they're looking at a 26, 27-year-old athletic, healthy guy, or who looks healthy. And so you got a cold, you have a respiratory infection, you have this, you have that, nothing major. And this went on, Jason, I'm telling you, for months. I was misdiagnosed for months and months and months. And, at one point they said, hey, we can't figure out what's wrong with you. We don't think anything's wrong with you, but we're going to send you to a lung specialist. We think it's something with your lungs, by the way you're coughing and this, that, and the other. I go to a lung specialist after a month waiting to go see the lung specialist, by the way. And I walk in, and he has an x-ray that the GP had taken. And he comes in and he meets me. He says, why are you here? And I go, you're supposed to tell me. And he goes, man, I'm looking at your x-rays, and even from your x-rays, you needed a biopsy like yesterday. And I said, wait a second, like when I hear biopsy, I think cancer. Is that what you're telling me? And he's like, yeah. And I was like, holy moly. And he goes, but listen, I'm a lung specialist, and I can't diagnose these stuff. It's just what I'm seeing. I already have you set up with another doctor. Go see him. And he already knew, right? So he had already set me up with another doctor, and he said, just go drive down the street, go see this guy. And he says, hey, we got to go in and do a biopsy. We're going to have surgery in the morning. So go in and, enjoy the rest of your day like I could, right?
And people think biopsy sometimes is just a small little taking a piece of your skin, but a lung biopsy, stuff inside, it's not a quick, easy procedure, right?
Luckily mine wasn't in my lungs. It was in my lymph nodes, right? And so they took it out of my neck. And they had to put me under. It wasn't anything easy per se, but it wasn't overly hard. But out of that biopsy, they told me I had cancer, and man, my world changed in that moment on. And here's a kind of like an interesting little story is, and I think people are maybe built this way. And I see it with, some of my kids and whatnot. Like, you're either built with like this real ultra competitive spirit, or you're not. And they end up telling me I was diagnosed with cancer a few days later after my biopsy. The general surgeon brings me in, and it's bad news when he brings you into the office, right? Where he's behind a desk, you're in a nice chair, and you see his diplomas on the wall. You're not in an exam room office. And so he says, hey, yeah, you're diagnosed with, Hodgkin's lymphoma. It's very advanced. So there's a lot of things that we have to do to try and get you better. And I remember thinking, I'm like, this is just, I didn't know what to do. My world was just turned upside down in that moment. And I'm 27 years old. I'm in amazing shape, like a 27-year-old is. That's really active, and so I just said, "Oh my gosh, am I gonna die?" And he's like, "Yeah, no, I don't think so. We're gonna fight this. I think you're gonna be just fine, but it's gonna suck." He walks me across the street to an oncologist who was already waiting. In the meantime, and this is probably like I go out and give speeches now, and this is a speech that I give cancer patients, and it was something that a friend said to me. I'm waiting in the oncologist's office. I'm hyper emotional. I was just diagnosed with cancer. When you think cancer, you think you're gonna die. I get a call from one of my great friends. His name is David, and he was a former first round draft pick of the New York Yankees. He had already been told from somebody else that I just got diagnosed with cancer. So he gives me a call, and just hearing his voice like made me really emotional. And so I pick up the phone. He's like, "Hey man, how you doing?" I'm like, "Man, I'm not doing good at all." And he says, I'm really excited for you." And I was like, "Wait, what are you talking about, man? This is like the worst news I've ever gotten in my life. Like, how could you be excited for me?" And he goes, "You have an opportunity to do something that not a lot of people can do. As your friend, I'm going to sit back. I'm going to watch you. I'm going to be so proud of you. And when you beat this, you're going to have a trophy on your mantle that not a lot of people have. And for that, I'm tremendously excited for you." And I remember, like, in the moment, bam, everything just clicked on. That competitive drive, everything clicked on. And I walked into the oncologist's office. I dried my tears. I walked into the oncologist's office. They said, "Hey, go home. Enjoy the holidays. When you get back, we have to get a bone marrow biopsy. We have to put your port in. Then we'll look to start chemo in about a month from now." And I said, "You are out of your mind if you think I'm waiting a month to start chemotherapy." I'm like, "Let's start today." And he goes, "We can't start today. We have to have a bone marrow biopsy and we have to have a port put in. Those are both surgical procedures." I said, "Well, let's do them today and I'll start tomorrow." And he goes, "Well, we need to get an operating room for the port to be put in." I said, "Hold on." I walked right back across the street to the general surgeon. Now, this is only like 20 minutes later, right, from when I was meeting the general surgeon. So I knew he was there. And I said, "Hey, can we do surgery? Can you put my port in today?" He goes, "Well, I'll have to call the hospital and see if an operating room is available." And I go, "Okay, I'll wait." And I just sat right down right in front of him. He picks up the phone. I'm waiting, and he goes, "Hey, operating room's available at 1. I said, "Okay, I'll meet you there at 1. Walked back across the street to the oncologist's office, and I said, "He could do it at 1. Let's get the bone marrow biopsy done." And a bone marrow biopsy sucks, but they'll put a lot of people under for it. We didn't have the time for that, so I just pulled down my pants right there in the office. They got out all these sterile equipment. They took a needle, like about that much, just jammed it into my hip, took the sample, sent it off. I went to the hospital, got my port put in. I was home by 5 o'clock that day, went to bed, had a great night's sleep, started chemotherapy the next day.
I think one of the important things is, trusting your own instincts, right? You knew something was wrong, even though professionals and doctors are telling you that you're fine. It's nothing. It's this. You're healthy. We saw a few years ago, if you remember, Taylor Cowens.
Oh, my gosh, yeah.
Such a talented fighter. He had gotten cancer in his early 20s, took 4 years off of MMA, was cured, came back, fought Grady Hurley on like a week's notice.
I ref that fight, and that fight was
crazy.
Unbelievable.
Up 3 weight classes from his normal weight class, and he put a beating on Hurley, really brought it to him, and Hurley at the time was one of the most UFC ready guys that we had in the whole region.
Mm-hmm.
And he came and fought for us at V3, had a really impressive win against Dewan Pickney, submission win. And he got scheduled to fight on the Contender Series.
Yeah.
And unfortunately, he ended up passing away shortly after his fight would have been. And again, he was a young, healthy guy, came back and fought, and he was trying so hard, but I heard at the end, he couldn't walk. He was in a wheelchair. He couldn't take care of himself, and he went from almost making the UFC to, we miss him terribly every day. He was such a good guy, and I thought he was legitimate. He was good. He would have made the UFC. And, cancer got him. So trusting your body, I think, and your gut is a good lesson.
Yeah, I mean, now that I have kids, I look at health 100% different. And after going through what I went through, I look at health 100% different. You know, before I'd be like, oh, I'm tough, I'm going to charge through. And now, like, I've learned, don't trivialize symptoms. Like, your body is telling you something for a reason. And if I would have done that months earlier, I wouldn't have been so advanced in my cancer. I wouldn't have almost died, which I almost died going through it. And it would have been a simple, you know, because it was a great cancer to have. If there's any cancer to have, it's the best cancer to have. If I would have caught it a lot earlier, but I trivialized symptoms, thinking I'm tough, I could push through, and I knew better, and I kept putting it off, and so, you know, now in my 40s, I think I'm just so much more in tune with my body, and I tell my wife this, like, she's like, something might be wrong or this, that, and the other. Well, go to the doctor. Go to the doctor now. Well, it might not be, but it might. So let's go to the doctor. I'm not saying let's, you know, freak out over stuff, but if we think something's wrong, you know, go get it checked out. And, you know, I learned a valuable lesson through all this is a lot of time general practitioner doctors are not as in tuned with overall, you know, wellness, or a lot of chart doctors, right? So it's like, hey, symptom pill, you know, or whatever, and then they get you onto the next place. Luckily, I've navigated that, and I'm like, it's something here. Where's the specialist for this?
And you know, my grandpa was a doctor, and he didn't treat symptoms. He treated what was wrong with you. And I think that's what a lot of times is. You've got a cough, here's a cough suppressant. You've got aches and pains, here's something to make those go away. You've got stiffness, here's something to make that go away. Instead of saying, okay, what's causing you to have a cough all the time? What's
Right.
causing those back issues? What's causing that? And that's where you really get deep into it. And, you know, if you have a doctor that's only wanting to treat a symptom instead of you or listening to you, if you get into a room and your doctor doesn't even make eye contact with you and just writes on a chart and gives you a prescription and says goodbye, and you have a $400 bill, find a new doctor.
Well,
Find a doctor that'll listen.
and unfortunately, we're numbers to a large degree, and so that's the exact scenario that almost killed me. I don't even know if I've ever told you this. Is they gave me a 30% chance to live through the weekend at one point, and it was because one, I had cancer. My immune system was so deficient. Had no immune system, but I had all these infections going on. I ended up, come to find out, I had these infections prior to even getting diagnosed with cancer, but yet my immune system was so high that it wasn't overly affecting me. So I get diagnosed because what happened was the doctor, exactly what you said, was just saying, hey, you have a lung infection, take this antibiotic. Wait, no, we think you have maybe the flu, take this antibiotic. I was taking antibiotics for months, get diagnosed with cancer, start chemotherapy. I'm into chemotherapy, and I was in really good shape. So they're like, we're going to hit you really, really hard to start. My immune system dropped to nothing, but I had multiple bacteria infections in my stomach from the offset of too many antibiotics that I was taking, that it just went crazy throughout my body, gave me septic, blood poisoning, liver failure, kidney failure. Both my lungs collapsed, and I got put in the hospital, and they called everybody and said, hey, they told my family I had about a 30% chance of making it out of the weekend, just because my body was in such bad shape from the infections.
Yeah, it's just a miracle. And what do you think faith played for you in your recovery?
I mean, that's a really obviously I grew up in a very religious household. I grew up Catholic, and I was confirmed, baptized, the whole nine yards. But as you're younger, growing up, it never was in the forefront in my mind. And I'll tell you a story right now, and I don't tell a lot of people this story, and it really changed my mindset of, I'm becoming a lot more spiritual of a person, especially, now with the family and kids. But even then, I had a long talk with a priest after this particular incident, and it let me know that the devil is real. The devil is real. They're trying to get you he's trying to get you at your most vulnerable point, and you need to believe in God. You need to believe in Jesus to overcome obstacles. And if you put your faith in that, you're going to be okay. So I was in the hospital, and I was very, very sick. This was in the point where they thought I was going to die from the infections. And I was hallucinating, and I'm completely sedated. So I'm hallucinating while completely sedated. And I remember I was on a demonic roller coaster, and I was just going like foof, foof, foof on a demonic way. Now I'm in bed, just, but it's real to me. And I came out of that, and I just think like, man, was that was that hell? Like, did I go to hell really quick? And it really messed me up for a while. Had a conversation with my priest, and he said, "Man, no, that's like that's the devil that's Satan trying to get you at your lowest point and weak, but you were strong, so you know we're good. Yeah, no, that was not hell. Like you're good." And from that moment on, it really did change me.
Well, that's a lot of people don't get sometimes at your lowest point. That's when people come after you the most, and we're definitely glad you pulled through it. And so now, did you have your son before the cancer?
Oh, no, 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 no. My cancer was 15 years ago.
Okay, so you had no children
No.
prior to that.
Yeah.
So you were still able to have your family. Were you married at the time?
No, I was a single guy. Well, actually, I had a girlfriend at the time, but it was a great girl. She stuck by me. Just didn't end up working out, thank goodness, because I have an amazing wife and family now. But on my way to my first chemotherapy appointment, you'll love this, and this is another way of just like, man, like it's just God is good, man. They told me this chemotherapy, you're never going to be able to have children. So at 27, my mission was to live. It was not worried about having kids. And but the oncologist nurse set me up at the fertility clinic and said, on your way to your first chemotherapy treatment, I want you to stop here. I had to stop at a fertility clinic. The fertility clinic. I had to make a deposit, which is humiliating in itself. They test it right then and there, and they say, hey, listen, your sperm count is next to nothing. You're so sick. We doubt you'll ever be able to have kids with this just because your sperm count's so low. I go and have chemotherapy. It completely makes my ability to have kids obsolete. And fast forward a decade, I meet my wife. I know she's going to be my wife. I know she's the one who I want to have kids with. I go back to that same fertility clinic. They analyze it, and they're like, "Man, this is great. You're going to be able to have kids with this." And I was like, "Man, God is good."
So, let's talk about that process.
Right.
So, what did you do? What was it? Fertilizing eggs? Was it using the frozen sample you'd given? How did that work?
It was in vitro, and luckily I met an amazing woman who loved me for me, and she understood the deal. And I remember telling her, I told her on my first date that like, hey, I can't have kids. You know what I mean? I didn't want to lie to anybody. I go, but this is what I have, and they don't think it's a good option. We ended up falling in love. I asked her to marry me. Prior to asking her to marry me, I said, let's go take a look at this. I just want everything to be out on the table. And they said, hey, you're going to be good. And so we started the in vitro process where they pull her eggs and they, do the whole science experiment. And we ended up getting 3 embryos. And this is how God is real is they say in vitro is a 50-50 proposition. We had 3 embryos. We only put 1 in at a time. We had 3 kids.
And one of them, your last one, she was, 6 years before she was actually put inside, or how long was that embryo stored for?
This is the craziest. Like, who knows what embryo was actually created first? So even in age-wise, one could be younger than the other. But this was back in 2008 that my sperm was frozen. Then maybe in 2016 we made the embryos. Me and my wife got married shortly thereafter. We were already engaged, and then put them in. So half of our child was a decade plus old. The other half was a year old at conception.
Yeah, an absolute miracle for all 3 of them to be born, and they're all healthy, happy, everything. So
interesting fact, though, my youngest daughter, she has 6 fingers.
Yep.
On her thumb. It's actually pretty amazing. It's awesome.
And other than that, she's perfectly healthy and happy. Unfortunately, she looks just like you, so we don't know how that's going to work out. Yeah. But she's literally your mini me, and it's just a really motivating story to hear that everything you went through and you still believed, because and then we come back to faith, right? You knew that that child, that embryo could have the potential for life, and you guys decided, let's try. I know there's a 50-50 and there's expenses towards it, but that could still be our child, and here you go, and I'm sure your world wouldn't be the same without it.
Well, we had a huge ethical dilemma on our hands. We never envisioned having 3 kids. I mean, who does really, right? It's like, the standard way of 2 kids and a dog, right?
Have your boy and girl.
Yeah,
You're done.
and we went 2 for 2 on embryos. We had 2 children, Ethan, my boy, Kyle, my daughter, and we had 1 left. And I was like, kind of really on the fence of like, what do we do? What do we do with it? And my wife was like, what do you mean? What do we do with it? I know we didn't want to have 3 kids. Like, this is a baby. If we practice what we preach, like, what do you mean? What do we do? We have to give it a shot. And Jason, this is such an inspirational or such a powerful story. We went to our fertility doctor with it. And I said, hey, listen, doc, if this is really meant to be, I want to take all the science out of it. I don't want to do the triggering shots. I don't want to do the hormone shots. I don't want to do all this stuff to time my wife's cycle and give it the ultimate chances. I want you guys to say this is probably the time and just kind of insert it and see what happens. And so we took all of the extra measures out of the way on this 3rd child, because if it was really meant to be, let's really make it meant to be, and bam. Little baby Hayden, six-finger Hayden was born.
Yeah, absolutely. What an amazing story. So now let's get into, we talked about your fighting, so you had your fight. Then you started competing in jiu-jitsu a lot, right?
Oh, yeah, I loved it.
You've competed at Worlds. Tell me about that experience.
Yeah, I mean, I've competed at Worlds a bunch of times. I started, I really gravitated to Nogi. I competed in both all the way, even up through black belt. I compete in both. I tended to do better in Nogi. Back, I even forgot what year, but as a blue belt, I went to Nogi Worlds. I ended up winning Nogi Worlds at blue belt. And then I was really just hooked at that point. And it was black belt or bust. And I just kept on, I competed all the time. I just love competition. I love everything about competition. I'm like, your grass is not going to be better than mine. Like, I love competing. And so jiu-jitsu was a great avenue where it was relatively safe, but I still got to compete combatively. And, so I got my purple belt. I won a lot of tournaments there. I won Nogi Pan Ams at purple belt. I won Nogi Pan Ams at brown belt as well. And, then my reffing career really took off. So I haven't competed as much at black belt, and, hope to compete again. But sometimes the risk reward with my other career of trying to really become a very high level referee, you got to make choices.
So let's talk about, what you've done inside the ring, not as a fighter. So you have been interested in refereeing, and you started doing that at a local level here in Memphis with V3 and with other promotions and in Mississippi. And it started branching out from there. One of the conversations I had with Shane Sparks is people hit him up and tell him, hey, I did a couple of high school wrestling matches commentating. Can you get me on the Big Ten Network? And it's like, do you realize what I did to get to the Big Ten Network? Do you realize that I was a sideline reporter for 10 years for no money, working my butt off to get to where I am now? And that's kind of the same story with you. I know you probably get people that see you now reffing for the UFC and on TV and with CFFC, and they're like, hey, can you get me there? No, you got to get yourself there. Let's talk about how you got yourself to where you're at now.
One, I had great mentors. First, the number one, David Ferguson, godfather of MMA here in the Mid-South. May he rest in peace. Was my best friend in the whole world.
Very first inductee in the Tennessee Martial Arts Hall of Fame.
Yeah, just an amazing man. But he originally trained me to referee at a very amateur, low level. And he was still, up until his death, I talked to him the day before he died about reffing, and he's still giving me advice. But I had a great mentor. 2, you have to be willing to do what it takes to get to where you want to go. And I was willing to travel and go to training seminars. I was willing to put my money where my mouth is. Like, I went and took a seminar from John McCarthy. I had already been reffing in the UFC when I went to his command course. And I walked out of it being like, I'm ashamed that I was almost reffing in the UFC. And I learned more in like a 3-day period with him than I had my previous decade of reffing, because it's the nuances. So you have to invest in what you're doing. You have to always be constantly improving. I mean, your continuing education has to be there. And I had to be willing. I'm still, well, probably not at this point, but for a very long time, I was in the negative financially because I was flying to Texas to take a seminar. I was flying to Vegas to go shadow. I was flying out here to go take another seminar or a training course. You know, I got ABC trained. I got my John McCarthy's command certification, and not a lot of people are willing to kind of shell it out. But with me, I'm willing to invest in myself. I knew I had a goal. I knew where I wanted to get there. And I know people are saying, this is what it takes to get to where you want to go. Unfortunately, not a lot of people are willing to take those steps, or sometimes can't financially. Luckily, I was able to. And man, I worked my butt off, though. I'm not going to lie. I worked my butt off. I had a lot of setbacks. I worked a lot of just lowest of low level shows to get the experience. And everybody wants to jump that line, and it just doesn't work that way.
Well, something I talked to Greg Jackson about earlier this week, too, was kind of like scoring and rules, where, yeah, we have unified rules of MMA, but every state can change the rules however they want.
It's the most frustrating thing in the world.
It really is that, when you watch boxing,
yeah,
the rules of boxing are the rules of boxing. Mm-hmm. It doesn't matter what state you're in. A spinning back fist isn't legal. A knee to the torso isn't legal. What a knockdown is the same everywhere, where we still have states where a grounded opponent might be different. A 12-6 elbow.
UFC just 3 weeks ago in the state of New Jersey, the 12-6 elbows is illegal. I believe it's the only state in the country right now that hasn't ratified the unified rules of mixed martial arts, for that rule at least. And it's like New Jersey. It's not like Iowa, right? Or somewhere maybe where big shows aren't coming through. It's New Jersey, and that is a real big frustration.
It is, and coming from where we were in Mississippi, where at one point the only state in the union that allowed a 12-6 elbow.
Right.
And what's funny is Nevada, who was the epicenter of combat sports, where unified rules got ratified, and even they at a time weren't unifying all the rules and had different opinions for what a downed opponent was. So it was very confusing. And if you're traveling and you're a guy on the regional level where you're fighting all over the place, that can be a huge issue when you're not understanding the rules.
Well, and a lot of times a lot of jurisdictions, let's take Mississippi for example, they're saying they're going by the unified rules of mixed martial arts, but a lot of things aren't on their in their bylaws, but it's the way they do it, right? And so it could be a massaging situation. I've gone to fight shows in Mississippi and in Tennessee, for that matter, where I'll have a conversation with the commission. I'll say, this is in the unified rules yet, but you guys haven't updated. What are we doing here? And they say, well, let's get you, me, and the commission together, and we'll see if we can make our own rule set. And one, it's kind of nice that we can do that. Guys like me and you can do that, and we have a somewhat of a pull locally to do that. But at the same time, it makes it a lot more difficult when you're going to other jurisdictions. And Nevada, you made that comparison. For them, prior to last October when they changed the downed opponent rule, it was weight bearing. What's weight bearing? What is weight bearing? I mean, if I am to put a scale down and barely touch my finger, it's going to register weight. It's very, very subjective, and it made it tough. Jason Herzog, because I asked him this exact question. I said, yeah, I have trouble with this. And he goes, the way I define it, and the way I'm defining it in my rules meetings is saying, if you're an NFL football player and you're in a 3-point stance and I move your hand, are you going to fall over or not? That's how I'm going to define weight bearing. Okay, we'll go with that. Now, thank goodness they changed the down opponent rule, and now it's anything other than the hands, the soles of your feet, excluding the hands. So it means if those hands are down, knee or kick away. But the minute that forearm touches, that elbow touches, if you're standing on your head, you are down. But if you're tripoded up and your hands on the ground, anything other than the soles of the feet, excluding the hands, and that's such a more clearer definition, and I really like it.
Yeah, and that's the importance of people understanding when they go to different jurisdictions and different states that they're not used to fighting is. It's up to you to understand what rules are. Like you've told me before, a lot of times the rules meeting at the UFC level is we're fighting under unified rules. That's the rules meeting.
Yeah.
That's it. There is no, where me and you in Mississippi, we used to literally have a script and read off every single thing that was a foul. So someone couldn't say, you didn't tell me I couldn't stomp on someone's head when they were a downed opponent. We had to literally break it down like that.
Yeah, and I mean, I go into rules meetings now. Let's just say if I'm doing a CFFC show and it's a high level pro fight because it's the highest level you can get outside of the UFC is a CFFC show. If I'm doing a one-on-one rules meeting, which I've done a number of times with you guys, I come up and I say, and I'm not going to back myself into a corner. So I'm going to say, hey, you're the main event. You're one fight away from the UFC right at this point. My job isn't to teach you the rules. I'm going to give you a few instances where if I say something, I expect something. If I say, fighter, you got to move, fighter, improve your position, fighter, fight back, just know I'm saying that for your benefit, not mine. Take that offensively and defensively at that point. But if I give you that command and I don't get a response, if I give the call, I don't get a response, it's not on me anymore. Just so we're clear. And that's now how my rules meetings at the highest level go. Because I'm not here to teach you the rules. That's not my job. My job is to enforce them.
Absolutely. Well, and your primary job is the safety of the athletes. That's what you're there for. You're not there to see a guy win or lose. You're there for safety. And sometimes when someone's not unconscious and they're in what appears to be a very tight choke and they're not reacting, they're not saying anything, and they appear to go limp, it's your duty to stop that fight. And sometimes they jump right up and say, well, I was fine. Well, unfortunately, you didn't look fine. And your job as a referee is to ensure the safety of the fighters, first and foremost.
Well, and I say this specifically in my rules meeting. I said, hey, if we're in a submission and I can't tell if you're there or not, and you're still there, I'm going to do a few things, something of this matter. Fighter, are we good? If I say, fighter, are we good? Listen, give me a thumbs up, wink at me, blow me a kiss. I don't care what you do. Let me know we are good. If I don't get a response, I never, ever want to put my hands on a fighter. But if I don't get a response, I'm going to come up and I'm just going to grab your wrist a little bit. Don't rip yourself out of position. Just show me you're there. If you do that, I'm going to let the fight go on. But if I do both of those things, if I give you multiple calls and I don't get multiple responses back, what do you expect us to do? We are here to make sure that the fighters go home as safe as possible. We're here to call balls and call strikes, but fighter safety is number one. And that's as simplest as it can get.
And I've seen videos out there of fights where a referee wasn't paying attention like they should have, and someone was unconscious and getting choked for 10, 15, 20 seconds longer than they... And it literally, it's like watching your kids drowned in a swimming pool.
Yeah.
It's so scary to see that happening. And you see coaches on the outside yelling and screaming and trying to get the referee's attention, and they're not paying attention.
Yeah.
So there's also the fact of the referee is ultimately in charge of whether the fight will continue or not.
The sole arbiter.
But a doctor comes in, and a lot of people don't understand this. A doctor can come in and advise whether the fight should be stopped or not. But you as an official, probably under no circumstance, if a doctor says this guy's going to die if he continues, or there's going to be a very severe injury if this fight continues, I'm advising you to stop the fight. I don't think there's ever a point where a referee is going to say, no, we're going to keep going. I'm not going to listen to the doctor. So when that doctor comes in, you're really, he's making the decision.
And a lot of times, and this is what you don't see, a lot of times it's constant communication. So when you're working in an amazing jurisdiction like Nevada, their doctors are cream of the crop, the best in the world. They understand MMA. They understand the sport. You might not realize this, but I am in constant nonverbal communication with these doctors at all times. And so if there becomes a point where, let's say there's a foul, I need to bring the doctor into the cage to address whether the illegal knee to the head, an eye poke, groin shot, whatever the case may be. there's a dialogue. There's been so many times where the doctor will come up and talk to me and say, Eric, this cut is very bad. Keep a very close keep a very close eye on it. If you see it widen anymore, call timeout, bring me back in. We're good to go now, but I'm scared probably in 2-3 punches it might not be. Very close eye. You got it, Doc.
I do have to correct you a little bit. I think we have the best doctor in the world out here, Dr. Eric Gardner.
Dr. E.
You know, he is the man.
Yeah.
And so that's something people don't get too is doctors are watching and they're looking, and when they advise you to stop a fight, a ref's going to stop a fight. So when you have a foul, even a foul committed against you or something committed against you, and you have to call a timeout and the doctor comes in, it's now the doctor's the one that's going to really make the decision about that fight being continued.
Yeah, technically the referee is a sole arbiter, but I'm not a medical professional. I can see and I can interpret what I'm physically seeing at the time, but I'm not a doctor. So I have never, and I don't see a circumstance where I will go against a doctor's recommendation. Now, I've talked to John McCarthy, and he's like, 100% a doctor told me to stop the fight, and I let it continue. He's like, because this doctor didn't know MMA. Like a cut, it wasn't going to stop this fight. It wasn't in a bad spot. They were just overly protective. I have not been in that position, and now with the advancement of the sport, I doubt I'll ever be in that position. But as a sole arbiter, technically, I could overrule the doctor. I would never overrule a doctor, though.
I think sometimes too, especially when you're competing at the regional level, we know these guys, and we know how tough they are. You know, we know that this guy gets a cut over his eye every single fight, and he's fought through it every single time. So kind of we can give the benefit of the doubt on situations like that.
Mm-hmm. So, yeah. I mean, you see, I truth be told, I don't like to let biases play a role, but they have to at some point. I've seen this. I know that he can get out of really bad situations. I let that play in, but but a doctor doesn't a lot of times, but it doesn't matter. But if you ever hear Bruce Buffer, he says, at 3 minutes and 28 seconds of round number 2, Jason Herzog on advice from the doctor. He doesn't say the doctor stopped the fight. He says Jason Herzog stopped the fight on advisement from a doctor. So.
And we've seen some, I guess, advancements in protecting fighters. And one of them was, just up to a few years ago, there was no timeout for a foul except the groin shot.
Right.
So you could get poked in the eye, you could get fish hooked, you could get hit in the back of the head, whatever it was. There was no timeout for that. If you couldn't continue immediately, basically you risk losing the fight. Mm-hmm. And now we've seen where if there is an eye poke, you can have up to a 5-minute rest period and use a towel to wipe the eye.
Yeah, and a compress as well.
And that's saving some fights. And we're also, referees and people have to understand, when people are leading with their fingers in both an offensive and defensive position, even if you're moving backwards with your finger out straight, that can be a foul. Is that something you want to see called more? Is that something you want to see guys getting points taken for more? How do you control if you see somebody with more of the Muay Thai stance where they're leading? Now, again, this is fine.
Yeah.
This is fine. But when you're leading with those fingers, it's not okay. And it's something we still see to this day.
Well, that is the foul. The finger going in the eyeball is the byproduct of the foul already occurring. So I'll take you now. Would I like to see it called more? I think it is being called more. I know it's being called more. It's a point of emphasis. I've been in enough commission meetings at this point to know that this is something we're not playing with anymore. Fighters are getting really good, and you might notice it. They're cleaning it up now, but fighters were fighting here as more of a defensive mechanism than anything, right? If I'm here, it's going to stop the advancement of fear, right? And so this is the way I handle it. And I say to fighter A in a fighter meeting, we are not allowed to outstretch our fingers towards our opponent's face. That is the eye poke rule. Now, with that being said, if we're doing it and I say, fighter, close your hands, fighter, watch your fingers. If I tell you to do that, please do it. Because if something were to happen because you were doing it and didn't give a reaction back to what I asked you, and you poke your opponent in the eye, now you make me interject myself into the fight, and now I have to make a subjective decision on something I don't want to. Don't put me in that position. Close your hand.
The ideal fight for most referees is no one even remembers who the referee is.
Yeah.
Because that means the referee didn't have to get involved. The fight was, happened within the rules. And I think a lot of people outside of MMA and positions that aren't fighters, they think they want the show to be about them and that it's about them. And it's not. I mean, I announce fights. I would be happy if I was never on camera because, again, it's not about me. It's
That
about
face?
the athletes.
That face?
Absolutely. It's about the fighters.
We all would, Jason.
Yeah, it's all about the fighters. And you see people interjecting themselves more than they need to, and it starts to make it about them instead of the fighters themselves. And that's what we came to know the sport. But again, your journey.
Well, just really quick, if I could add something
Yeah.
on that point specifically, John McCarthy told me something. It was one of the best advice that anybody through this training that I was given is a referee can never make a bad fight good, but can always make a good fight bad if you over officiate it, if you inject yourself, if you make you part of the fight. Don't do it.
Absolutely. Now let's go back to your journey a little bit. It wasn't a phone call one day. You're reffing a fight in Mississippi, and it's, hey, you're working a main event at the UFC tomorrow. Absolutely not. It was, hey, you want to come out to fly to Vegas, and you can shadow some referees. You can be in the rules meeting. You can be at the grease spot. You can be at the cage. You can be at these things. So talk about a little more about that journey as well.
Well, like I said, I mean, you had to be really willing to invest in yourself, and I was willing to do that. And luckily, I was capable of doing it. I had the passion. I had the experience at that point, and luckily, I had been getting noticed. And upon getting noticed, and it was getting noticed off of great promotions like Cage Fury. And, I was given the opportunity to come out and shadow and ingratiate myself out in Nevada. I was able to go out and, listen to the commission pre-briefs, talk to the big dog refs, to the Herb Deans, Jason Herzog, Mark Smith, Dan Mergliotta. I was able to sit and just pick these guys' brain. And then I said, can I do this again? Yeah, okay. Yeah, we'll let you do it again, I guess, on my own dime. I'm not getting paid to go out there and learn. I'm going out there and I'm learning. I did that probably more times than anybody should. And I would take what I learned back to the regional scene, and it was elevating me on the regional scene as well. And I'm just sharpening those skills. And then luckily, I got that one break. Can you do a Dana White Contender Series? You were one of the first calls I made, Jason. I said, man, I just got called to do a Contender Series fight. And, man, I had to thank you and, everybody with Cage Fury, because that that organization in particular is what gave me my biggest platform to date, was where I was being seen. And, I had some really tough calls to make on your guys' show, which made some headlines. And luckily for me, for the right reasons, some other fighters for the wrong reasons, but for me, for the right reasons, and where opportunity and, meets willingness and determination, you could get there.
I mean, there's been times where you showed up to North Dakota and there was supposed to be another official and they literally didn't show up. And you've got 12, 13 pro fights in one night to referee, but you were able to do that. And that's, what gets you noticed when you're willing to go the extra sacrifices. Flying up to North Dakota, it's not convenient. We've had you in Florida, Tennessee, Mississippi. And matter of fact, this month you're going to make your debut in Pennsylvania.
Yeah.
And you're going to come out to CFFC 155 in Philadelphia and be in Pennsylvania. They've noticed you as well. And like you said, a lot of these referees that you see in the UFC, they are still working at the regional level. We've had Dan Mergliotta. We have Keith Peterson.
Keith Peterson is he works more than any referee out there. And 90% of it is on the regional scene.
And he's phenomenal to have at a show. Vitor Shaolin, one of my favorite referees. He works a lot in New Jersey. He works a lot of the UFC BJJ, CFFC BJJ. I mean, he's all over the place. He's worked for he's rising. He's all over the world doing this stuff.
Right.
So don't think that once you get to the UFC, that's it. You're just working for the UFC every weekend. No, you're still going to be working for other athletic commissions all over the country and taking those opportunities wherever they can. And again, on your own dime, a lot of times you're paying for seminars and travel and hotel stay and buying your food while you're out, but you've made an investment to get to where you want to be.
Yeah, I think it's with anything else. It's like, how bad do you want something? I wanted to ref at the highest level in the world very badly, and I knew that, how do you get there? How do you eat an elephant one bite at a time? And you eventually get there. If you got the determination, you got the skill, the want to, you develop the skill set with having the right attitude. It's like, honestly, one of the biggest things as well. You don't ostracize yourself. I remember I went out to shadow a UFC event. And David Ferguson gave me the best advice heading out there. He says, don't go out there and tell any of the guys and try and prove how much you know. Go out there and just make them like you. And now I've got Mike Beltran I consider him a great friend. Jason Herzog, I consider him a great friend. Herb Dean, man, because I went out there and I forged friendships with these guys too. I didn't come in saying like I'm on your level. I wasn't on your level. I wanted to be humble. I wanted you to teach me, but I also wanted you to see that, hey man, I could hang out with you guys too.
And you can do the job when it comes down to it.
Yeah, absolutely.
That's what's important. And that's what we look for is, really a command presence and someone that's educated on the rules, because rules do change. We've talked about it. Different states, different athletic commissions. A commission can have a board meeting a month before a fight, and rules can change, and it's up to the officials to stay up to date on that.
There was times that that downed opponent rule was just going back and forth, whether it's like, if any point of the hand is down, they're down. No, it has to be considered weight bearing. Like, it was going back and forth. So as a referee, I was always having to go back. Like, I'd be driving to an event or flying to an event, and I'm pulling up the ABC rules and regs, and I'm like, oh, they changed it again. You know what I mean?
Yeah.
Because if I'm giving that rules meeting, I need to be able to tell it accurately.
Because we both know that if you don't say it and somebody loses because of something you said wasn't legal, and they're going to complain and file a grievance, and we've seen it all the time, and so it's really important. So understand that when you have competent referees at a fight you're at, it's going to make the experience better for everybody.
Well, and I always say in that regard is that, like, do you understand the rule, why you are doing the rule, and how to interpret that in different situations. And, John McCarthy said it best. And I refer to him a lot because he's been very helpful in my career. And I still call him all the time if I have a question or just to watch a fight that I refed. And he's so gracious, and he'll watch, and he usually tells me where I messed up, but only he will see the mess up. But it always making me better. Is he says, what's best for the sport, what's best for the fighter, what's best for the promotion, and what's best for the crowd. If you can make a call based on all those factors, you did your job as a referee.
Yeah. Let's talk a little bit about a board that you sit on, the Tennessee Martial Arts Hall of Fame. You're on the board of directors. And the very first person that we elected was your mentor, Dave Ferguson. Now, when I came up with the idea, I'd always flirted with the idea of a martial arts Hall of Fame because I really thought there was a lot of special people that came out of this area that deserved some sort of Hall of Fame and recognition. And when Dave was diagnosed with pancreatic cancer and a very low survival rate, I said, you know what? This is the guy that I've got to get in. And you jumped on the board with me, and we got Dave elected. And, it's kind of funny. I was told, he's doing better. Maybe we can hold off a little bit and we can take more time to plan this event. Mm-hmm. And something told me, like, no, let's do this. Let's do this. And in just a couple weeks, we got an event with over 100 people. And it was really special because it was his 50th birthday.
Yeah.
We got him elected into the Hall of Fame.
And when we picked the date, we didn't know it was his 50th.
We didn't know. Yeah. It was his 50th birthday because we had did a week before, and that was the same day as the black tie and boxing, and Anthony Manus, another board member, couldn't be there. So we pushed it back a week, and it just so happened to be his birthday. And the really special thing about that was a lot of people that hadn't seen Dave in a long time got to come, and a lot of people got to come that never got to see Dave again. And that was really their last time to get to see him. And he even said it in his interview, minus getting married and having his kids, it was the greatest day of his life. And it was really special to have somebody like that, like you said, really a pioneer. a legend in the MMA community. You know, this is a guy that fought Dan Severn on 2 hours' notice.
At a like a 70-pound weight
In a
disadvantage.
burner show under 70 pounds under, not knowing who he's going to fight. Oh, hey, you get to fight one of the greatest UFC athletes that
You want
history's ever seen.
He told me that story. You want to hear it?
Let's go.
So it's in a show. I think it was called The Danger Zone. It was a show in Arkansas, and Dan Severn was the main event. And it was called like Return of the Beast, The Danger Zone, Return of the Beast. And this was basically, he was the ultimate heavyweight champion for the UFC back in the day when it was called the Ultimate. I don't remember that. And so he really would then go to these like regional, he'd go to different regions and be the main event and probably make a good amount of money because they weren't under exclusive contracts at that time. So he was in Arkansas. He was the main event. The day of the show, like hours before the show, his opponent pulled out. Now Dave Ferguson was fighting at 185. Okay? He was the co-main event. The promoter freaking out because now Dan Severn, who they built the whole show around, doesn't have an opponent. What's going to happen? He comes to Dave and he says, "Hey, Dave, will you step up and fight Dan Severn?" And I believe I have this figure right, but Dave was going to make $200 as the co-main event. Now this is back in I think 99 or 2000. Yeah, I
think it was 99.
99.
Yeah.
And he told the promoter, he goes, "Well, if you double my purse, I'll fight Dan Severn." So he made $400, and I actually watched the fight. Very people have ever seen it. It doesn't live online anymore, but he has the cassette tape, and then he digitized it onto his computer. But shortly before he died, I was over there, and I watched the fight. Man, he was piecing Dan Severn up on the feet, and then Dan Severn says, "We're done." Just boom, slammed him down to the ground.
I mean, think about that too, how much the sport has changed, where something like that was virtually impossible to even be allowed by a state athletic commission anymore. They especially the size difference, an athletic commission would say, absolutely not, you're not doing it. Even most states, you have to have everything finalized 4, 5, 6 days before the show even happens. And so for that to even happen was pretty crazy. And, all the things he built, he built Memphis Judo Jiu-Jitsu out here, which was really one of the biggest gyms in America, square footage wise, and still has a lot of guys training there. And, he welcomed me in there. I've trained for a fight there before myself. And, he never charged us a penny to work out there as amateur athletes. When you were an amateur fighter, you were welcome to come in and take classes and work out and train whenever you wanted. And it made it such an inviting environment for everybody.
Yeah, I mean, there couldn't have been a better inductee. It's the first ever inductee to the Hall of Fame than David. I mean, it's hard to talk about just because he was such a great friend of mine. But as glowingly as I talk about him, I mean, there's 100 people in this market that will talk about him the same way. He's absolutely amazing. But I mean, he was back before there was IBJJF Worlds. There was the Arnold grappling tournament. Like he was grappling against Frank Mir, and Jeff Munson back in those days. Like he was when I say a pioneer in this sport, he was a pioneer in this sport, not only here, but in the country. And there couldn't have been a better first inductee.
And people don't get how good Jeff was back then. He was under Laborio, and those were some badass people back then. I mean, these were warriors. Your Mark Kerrs and your Mark Coleman's and all these guys that were out there fighting. I mean, these guys were murderers, and it was a great time to be in. We're definitely honored to have him, and we've had Anthony Manus elected, and we've got a couple other people that are elected that we're hoping to get in this year, and we're going to continue that mission of really recognizing the martial artists in the state of Tennessee and that have contributed to Tennessee, and not just martial artists, but everybody, from referees to judges to gym owners to whatever it is, we're here. And so, hit us up if you think somebody that is someone that should be recognized for their contribution to the state of Tennessee. Don't hesitate to let us know. We would be honored to put them in front of our board and possibly elect them.
I got to tell you this though, Jason, it's like to get that event off the ground on weeks' notice. Man, you were like a dog on a bone getting that done, and we did it at the
VFW.
The VFW here in Collierville, Tennessee. I mean, you were able to get it donated, but I think the capacity was 80 people. We ended up going at, I think, over 100.
Yeah, there's about 110 people there.
110 people that night. We raised over $10,000 that we were able to aid in Dave's, cancer battle. And man, dude, that was a great night.
Yeah.
And you said a lot of people, that was the last time they saw him. That was the last time I saw him.
Yeah, and what was nice is you got a lot of things donated. We couldn't have done that without all the donations. We had people donate prizes, and we had people there selling shirts, and they gave 100% of the proceeds to them. And we did a silent auction, and the ticket prices. We had the food donated. Grant Gibbs donated food, and a lot of other people donated food so that we could
Shout out Chick-fil-A, right?
Chick-fil-A, baby. I was there last night, and again, we were able to give Dave $10,000. People don't realize cancer's not a cheap thing to fight. He was having to travel back and forth to Houston and Phoenix and all these places, and it was a huge burden on him and his family. And I know that, that helped him out a lot.
Yeah, and he was very grateful. I gave him the certificate of when we voted on who was going to be the first ever inductee, and it was David. I went over to his house, and we put it in a manila folder, and I brought over lunch for him and his family. And I said, "Hey, by the way, I left this was left on your front door." And he opened it up, and he was like, he was. I mean, even in that moment, he was almost in tears, and he says, "I was wondering if anybody was ever going to do this," and he's like, "I can't believe this is happening, and I can't believe I'm the person you guys are putting in." So it was pretty awesome. I mean, it was one of the greatest things that I've been attached to, not only just for the cause, but then the person, but watching you just take control and say, "Hey, 3 weeks notice, like, who cares?"
Well, I mean, you and your wife did a tremendous job at decorating and getting the door prizes, and this wasn't something that I was able to do on my own. It would have never worked if I had done it on my own. But I think we have an amazing board of directors with Nick Harmeyer, who helped legalize and get MMA rolling in the state of Tennessee. Robbie Beard, a guy that really has helped gyms flourish throughout the country and has an amazing pedigree himself. Anthony Manus, who's also an inductee, who is one of the absolute pioneers as well, along with Dave in martial arts. And I think we're going to do great things. We're looking to add more people to the board of directors in Central and East Tennessee, so that we can really get as many people in as possible that deserve it and recognize it. Again, I was told one time that Tennessee didn't deserve something like this, and Tennessee didn't have the people to do it. And
how many
I
world
took that as an
champion
insult.
kickboxers came out of Tennessee?
Absolutely, and karate guys and jiu-jitsu guys, and we're getting MMA guys to the next level all the time. We've had a lot of CFFC world champions out of Memphis. Kevin Peace out of Memphis just became the very first male 2-division professional champion for CFFC. And think about all the guys that have won CFFC titles that are now UFC fighters and have won UFC titles. You look at Marab. Marab is actually 0-2 in CFFC. He lost in MMA and he lost in grappling. And he was a UFC champion. So that goes to show you how tough of our fights are. We don't give handouts to anybody. So what's next for you? You've been working slap fighting. Is that
Power
something
slap,
you're going to get in? Power slap.
I really enjoy working power slap. It's very difficult to ref. Truth be told, there's a lot more rules than people think, and body positioning, and it's a wild sport. But I really, really enjoy it. I'm going to continue growing, and I just want to continue climbing that ladder of trust, because that's really how you grow as a referee. Or do these athletic commissions trust you? Do they trust you to make the right call in a hard moment and be able to articulately back up why you did it? And that's why having such a deep knowledge of the rule set is so important, because I could say fighter A did this, and because of this, this is all that transpired because of this one foul, and he intentionally fouled somebody, it caused an injury, therefore there shall be a 2-point deduction. And see, a lot of people don't understand, there shall be. It doesn't mean it's not up for debate. If you intentionally foul somebody and there is an injury because of the intent of the foul, you must take 2 points. I see this all the time in the regional. Somebody will throw a headbutt, it'll cause a little cut, the ref will jump in, stop, timeout. What are you doing? Okay, 1 point. No. Stu, by the rules. So it's a long way of saying what's next for me is continuing studying, and I'm going to continue to keep going to seminars. I'm going to continue to watch the best in the business, the Mike Beltrans, the Herzogs, the John McCarthy's back reffing. I study for them, I call them, I talk to them, and I just want my trust level to go up and up. And luckily I'm now going to be working a show in Pennsylvania coming up, and I'm anxious to get that trust of that athletic commission, and hopefully just have another athletic commission that can call me and know that I'm going to show up, be professional, do a good job, and somebody they can trust. That's what's next.
Now, you also have your own gyms, right? Tell us about your gyms.
Yeah, me and David Ferguson actually used to own a bunch of gyms. After he passed, I just wasn't in the business of wanting to do that, so shut down some. And now I got one gym. It's called Fit Defense of Collierville. It's right here in Collierville, Tennessee. We do fitness, kickboxing, jiu-jitsu, kids jiu-jitsu. I have a really brand new MMA program in there. This is really fun. I'm tailoring it towards middle-aged men, so we have the ability to protect ourselves and our family if we need to. I always say, if you're, my goal is to not train a world championship fighter. My goal is to train a dad to feel confident protecting his family.
Well, when I become a middle-aged man, I'll have to come check that place out.
I think I got that beard, man.
Got a few years, and that's a thing that a lot of people don't get is the confidence that knowing how to fight and knowing what it's going to be. I think every man should get punched in the face and understand that, one, there's a lot of guys out there that peacock around that'll get folded in a second. And there's a lot of guys that have confidence because they know that they can get on a jiu-jitsu mat and go 5 rounds for 5 minutes apiece, and they're not going to die. And you'll never hear them barking because they understand that if it really did come down to it, they're going to handle themselves. So I think it's important for men. If you don't always have to have a gun to protect your family. You don't want to go through those lawsuits and arrests and all that stuff.
Well, and there's a 30-foot rule with a gun too, right?
Absolutely.
It's like if somebody's charging at you within 30 feet, to be able to unholster, if you have to chamber and get one off in that time frame, it's just not going to happen. You better have the ability.
And on target and without shooting somebody else.
Yeah.
There's a lot of things. But when if somebody grabs you, if you can confidently, one, your lungs aren't going to be handicapped and handcuffed, and you're gonna pass out in 20 seconds anyway, to know that you can control the situation. And it's really nice to choke someone out, walk away, get to your car, and a minute later, they're waking up not knowing what the hell went on. They're not injured. There's going to be no future lawsuits coming, and you're already in your car driving away.
Yeah, I think at our primalist nature, it is to survive situations. I'd rather, somebody said it wasn't me. I'd rather be a gardener in a war, or I'd rather be a warrior in a garden than a gardener in a war. I need to be prepared. I need to make sure my friends are prepared. I need to make sure the men in my community are prepared. And we teach a lot of kids in jiu-jitsu, and I have a lot of parents come in and they say, "Do you ever teach conflict resolution?" I say the short answer to that is yes, of course. I teach confidence. If you have confidence, it's amazing the confrontations for kids will go down just by the confidence level they have. Bullies are not going to pick on confident kids. They're going to pick on weaker kids. And so just the confidence to stand correctly, knowing that you have training, that speaks more than any words could.
Now, what about law enforcement? Do you have any special law enforcement programs or anything like that?
Actually, yeah, we do. We have tons in our community, in the surrounding areas, Collierville and Germantown. I put out a program price to cops that was almost unbeatable. I don't really want to say it out here because I don't want people to say like you're crazy or whatnot, or other clients saying you're giving these cops these discounts, but it was unbeatable. And my goal is I want to make my community the safest community possible. A lot of people say like, oh, there needs to be police reform and this, that, and the other. Like, yeah, to a degree, they need to be trained more. They need to know hand-to-hand combatants more. They need to know more jiu-jitsu. I want to be able to provide that at a cost where, they can do it and they don't have to think about it. And I always say a well-trained cop is a confident cop is a safe cop.
Well, the less trained you are at hand to hand, the more likely you are to escalate your use of force.
100%.
That's where a gun comes out, a taser comes out, pepper spray comes out because you can't use your hands. I used to train with a guy named John Ogden. He was a judo guy. He was a cop back in the 50s and 60s down in the Pike in Long Beach when all the Navy guys were down there drunk and fighting. He said, I never pulled my gun out one time. 50 years of being a cop, I never had to take my gun out. I just kicked their ass. And it was that simple.
Well, and just even just to subdue somebody.
Absolutely.
And, it's just, it's, we could go on about policing all day, but specifically here in Collierville, Germantown, Memphis area, I want my community to be safe. And if that's willing, if that means I'm going to take less of a profit margin to do it, then so be it. And because I'm from a law enforcement background. My dad was a retired police officer. My grandfather was a police officer. And, I want to give these guys the ability to train. I want them to have that release. And that's where, like, a big thing of this is what I've noticed is this is their happy place. This is the camaraderie that they need. This is the stress relief that they need. And we're providing an amazing skill that they need on a daily basis. Military people will go out on an operation. They come, they have to debrief. They may be sat down for a while. You're not going out and do this mission. Like we need to, cops are doing this every single day. They need to have this skill set and they need the mental release. And that's what we're trying to provide at the gym.
And a lot of times people don't realize it's just a fun workout. Oh. Like it can be, sometimes it gets boring. You don't want to go to lift weights or you hit a treadmill or do something like that. You're still getting a phenomenal workout at the same time that's different every single day and keeps you guessing. And I think that's one of the really, really cool parts about doing jiu-jitsu.
Well, and I think the camaraderie of it, it's a very intimate sport. In mixed martial arts, it's a very intimate sport. Like I'm doing like a middle-aged MMA program, and a lot of cops are taking this with us. And it's just really, really fun because we can have a camaraderie in there that we would never say this stuff to each other on the streets, right? But if we're in the training room, it's funny. I'll be on now. They're a white belt, I'm a black belt, and we're training, but it's such a fun environment that I'll have them wrapped up in some way, shape, or form, and I'm like, wait, you're in charge of protecting our streets? It's just so much fun, you know what I mean?
Absolutely. One more thing before I let you go. You have talked about potentially serving your community even more in the future, being potentially an alderman in Collierville or maybe serving on the school board and really bringing your conservative Christian values to the forefront of leadership. Is that still something you're considering doing?
100%. I don't think it's a matter of if, it's a matter of when. My positions on things are, faith, family, and Collierville is a great town. I think we both love the town of Collierville, but I don't want to be in a good old boys network with it. I want to be in a position where we're going to be doing the right things every single time for the right reasons with conservative values, fiscally conservative, with the goal of keeping Collierville because this is a destination that families want to move to. And I want to keep it. I love living here. We drive down the street, me and my wife all the time, and it's just the trees on the side of the road. And we're like, oh, why would anybody live here? And we say it tongue in cheek because it's so beautiful that of course everybody wants to live here. And I'd love to serve my community. I'm a big service-based guy. So, if I could serve my community, I try and do it through the gyms. And if we could do it, on that next level, I'd love to do it.
And the safety of this town, when you came to my house, you saw all the kids outside playing, and they can play out there without anybody watching them. And I left my garage open last night. Anybody could have walked in my house, and nothing ever happened because this town is so safe. And what's amazing about it is we're 15 minutes from what's considered one of the most dangerous cities in the United States.
The polar oppositeness of where we're at to 20 minutes down the street is mind blowing, and I think it's a lot of what we're talking about and why, I want to run and you've ran and I assume you're going to run again is we have pride in this community.
And it's a great place to live. I got my parents to move out here, and I tell people when I travel to Philly and I travel all over the country, I was just in California earlier this week for the IBJJF Worlds, and of course it was beautiful. It was 75 degrees, and it was great. And it's like, how could you leave here? I said, one, gas is $6-something a gallon.
Right.
A 1,000 square foot house is $950,000 in not a good neighborhood. There's traffic everywhere you go. I said, I literally live in a utopia. It's such an amazing place to live, and I really do hope that you strongly consider very soon, maybe even this coming up election cycle, running for one of these seats. I think there was people that were appointed to the board that didn't run, and probably need to run and have a good opponent because they were installed, not elected, which I'm not a big fan of. And I think you would make a great alderman or school board member, whatever it is, to serve this town with your values and your leadership and your time to be able to commit to these things is what's really important. That you've done it with your children. You've shown that faith is important, and that's the kind of leadership that we need in this town. Anything before you go you want to shout out or tell
Well, I do
us
want
about?
to say this to piggyback on that point. Like, if anybody in leadership, if you're not doing it for the benefit of your constituents, the benefit of your people, me and Jason are coming for you. We're coming for you.
Not me. I'll help Eric out. I did my thing. It was a great experience. I got to meet some great people and I got to learn about a system, and I saw a lot of things that were eye opening to me. That hopefully I can pass that experience on to you, Eric, when you decide to run, and we can game plan a great campaign for you with your knowledge and your endorsements. And I think you'll be a great guy to serve our town for years to come. So next week we're looking to have another election in the spotlight. Brad Less, who is the Republican candidate for the Shelby County Sheriff, is going to join me. We don't know if it's going to be in studio or online, but he will be joining me. So get your questions ready for him. We're also going to have a special shelter adoption episode where we are going to have Memphis Animal Services on, and we're going to highlight some urgent need animals that need adoption. We'll try to be on as long as we can, as long as the animals are getting adopted. Maybe people are making donations. We can get some commitments. I made a post a couple weeks ago that hurt some people's feelings about an interaction I had with a volunteer that I thought was done wrong. And I am willing to, put my money where my mouth is and give Memphis Animal Services a platform to show that I'm not against them and that I really do support their mission. I just didn't like the way something was done, but they've been extremely respectful and thoughtful during this process, and I'm excited to have them on. So don't have those dates and times firmed up yet, but they will be next week. We'll let you know as soon as possible. And I thank you guys for joining, and hopefully we'll see you next week.